everybody's a patient at some point in their lives. And this communication with doctors is very tricky because there are limited appointment times. And I found that I was going through my own post-transplant recovery period, and I was seeing about 10 different specialists. And I had to figure out how I could communicate from one to the other and really be the coordinator and, in a way, the CEO of my own health. So I started doing research. Have people already researched this topic? How come none of my doctors? How come I work with hospitals? How come I've never seen this before? And I thought there was a need out there to give people an organized pathway, easy to use pathway to communicate better with doctors, and thereby being more engaged in their health and their healthcare and their wellness.
Welcome to Leading the Way podcast, where you'll learn neuroscience-backed ways to lead more effectively and have more fun at work with what you already have. Hey there, it's Chris, and welcome to Leading the Way. So excited you decided to join us and have an amazing guest, Dana Sherwin. Dana, thank you so much for being on the show with us today.
Thank you, Chris, for having
You bet.
me.
Yeah, I'm
Appreciate
delighted.
it.
You bet. So, Dana, you know about you. I know a little bit about you, but everyone listening doesn't. So I'm going to paraphrase a little bit of your accolades so folks know the amazing talent we have with you and us today. So Dana Sherwin is the founder of the Thinking Patient LLC. It's a professional services firm providing consulting, speaking, and training resources to support and enhance patient-physician communication. She's served as a healthcare executive and also with consultant positions throughout her 35-year career. She's worked with hospitals, managed care plans, and the three of the largest public accounting managed consulting firms in the USA. She really knows her stuff. She holds a Master's of Health Service Administration degree from University of Michigan School of Public Health and a Bachelor of Science from Cornell. She's a fellow in the American College of Healthcare Executives. She serves as a volunteer advisor for the Blood and Marrow Transplant Clinic Trials Network, and she's a member of the 2024 editorial review board of the Journal of Patient Experience. Dan, again, so delighted to have you with us, and such an important topic. I think it's been an important topic for over a decade, but tell me more. What got you into wanting to help people's experience and have a better experience of talking to their doctors?
Thanks for having me on the show. It's obviously a major focus of my work, and also my energy and my passion. I had a very long career, as you described, in healthcare administration, and I was all about giving people more access to care and making systems easier for people to use. And I didn't really pay much attention to my own health. So I was diagnosed with a chronic disease about 20 years ago, but I was able to live a fairly normal life. I was monitored. I had children. I was able to work full time and take care of all my business. But about 6 years ago, my health crashed, and it was because of this chronic disease. And I needed to leave my career suddenly. And I had a chronic blood disorder, and the only cure for it was a stem cell transplant.
Mm.
So I had that transplant in 2019, and I'm here today. My recovery is going very, very well. You're never really totally recovered, although my doctor says that I'm in remission. But after about 2 years, and again, this was during COVID also, after about 2 years of working through some of my bigger health issues and feeling better and thinking, how can I stay involved in the healthcare field? And what have I learned about being a patient? What have I learned that I can use my professional experience plus my personal experience to share with other people? And that's really where I came up with that. Generally, communication with doctors is very hard. And whether you see doctors once a month or once a year, everybody's a patient at some point in their lives. And this communication with doctors is very tricky because there are limited appointment times. And I found that I was going through my own post-transplant recovery period, and I was seeing about 10 different specialists, and I had to figure out how I could communicate from one to the other and really be the coordinator and, in a way, the CEO of my own health. So I started doing research. Have people already researched this topic? How come none of my doctors? How come I work with hospitals? How come I've never seen this before? And I thought there was a need out there to give people an organized pathway, easy to use pathway to communicate better with doctors and thereby being more engaged in their health and their healthcare and their wellness.
Dana, I love that because for so many reasons. One, thank you for stepping up and using your tribulations to help and serve other people. That's beautiful. But even more importantly, healthcare can feel overwhelming, right? It seems like there's this giant organization that's against us, whether we feel that that's the provider or the insurance company or big pharma or whatever it is. And it can feel like we can't make change, but we can absolutely up our game and how we talk to our care providers and be prepared. It's something that we can all do and take action on, and get results. I'm curious, as you've done this work and worked with others, I grew up where you just sort of trusted your doctor and whatever they said or didn't say was it, and you weren't supposed to question, that outcomes. No, that's changed over time, but are you still seeing that pattern where people are maybe afraid or intimidated to question or ask questions of their care folks?
Yes. And I think, yes. So the medical profession over maybe the past 15 years has done a great focus on how we could do more shared decision making, how patients could be a partner in the care. But this comes a lot from the perspective of the doctor. So who's really educating, training, giving people the skills that they need to be the most effective patients and communicate on their behalf as possible, and to really self-advocate, but not self-advocate in a negative way, because we always look at maybe, oh, patient advocacy, that's because something's going wrong and people have to advocate for themselves. No, self-advocacy is really about taking care of yourself and making sure you know yourself well enough. And if you don't know something, to ask, but to also one of the biggest parts is letting your doctor know. Letting your doctor know who you are, what you're feeling physically, mentally, psychologically, experientially, and doing that in a really organized way, because again, limited appointment times. And that's, it's a big part of, so I do think that it's not just that it's a trend. It is an aspect of generally people's mindset. People
Mm,
don't want to be sick. People don't want to see doctors. People, I was guilty of this. I put my head in the sand. I had symptoms of my disease for many years, and it was a genetic disorder. And back then, really 30, 40 years ago, there was no genetic testing like we have today.
right.
Um, when I was diagnosed, 2 years after I was diagnosed, they just developed the genetic test for my disease. So it was really, everything was advancing. And I mean, I had the benefit, I had a confirmation this was the disease that I had, but the doctors knew about the disease. They just didn't know how to identify it as quickly as possible. In fact, now there's a blood test. You don't have to go through all of these complicated lab testings. There's actually a blood test that could help determine whether you have this blood cancer that I have. And I don't know if I just read about it. So it's very exciting that new things happen all the time. But back to your original question of, are there trends for people? I mean, people will always have worry or trepidation when it comes to their own health and taking care of their health. And some people think just because you exercise and eat right means that you're never going to get sick. I mean, that's not true either, because there
Right.
could be genetic disorders and whatnot. So I think we're always going to be in a situation where people are human beings who have, fears, and nobody wants to get sick. And then it's really complicated because doctors have a clinical expertise that we don't have as regular patients.
Right. No,
And
so well
so
said.
there's this sort of feeling that, you're not going to understand everything that the doctor's going to say. And so I wanted a way to cope with that too, because even though I was in the healthcare field, I wasn't a clinical person. I didn't have any clinical background. It wasn't my interest. My interest was to really work on the management and the leadership side with systems and getting people access to care and insurance related and Medicare and Medicaid. And that's sort of what I focused on, not the clinical. So having such a complex disease that I had, I really have to push myself to understand and to take notes and to do my own research and to self-educate as well.
No, that's great. It's great. I want to pivot a little bit. You talk about you've got a 5-part framework. Can you talk at a high level what that framework is? How is it different using that framework versus what people are doing today?
Okay, so let me just give you the overview of the framework, and the parts of the framework are usually depicted in sort of a pie-shaped format with all the ends. Everything really connects, and it doesn't matter which part you start from, but it'll come clear what sort of the process is around it. So the first is preparation, and it's preparing for every visit that you have, and taking a notebook and writing down what your priorities are, what your agenda is, what your questions are, research other things. Have a lot of suggestions related to how to prepare for doctor's appointments. And then there's the language. So part 2 of the framework is language. It's important to know the language of your disease. Whatever your diagnosis is, you should know how to explain it, how to pronounce it, and what's all involved in the diagnosis. I say the same thing about medications too. I have very smart friends who can't pronounce it. I said, and they just sort of give up. So if you're taking a certain medication, you should be able to pronounce that medication and know what's the dosage you're taking, how to take it, but it's about learning about it. So language, and then there are a lot of other aspects of your clinical condition that is very helpful to have the language of that. And we can come back to that if you like. The third is questions and being good. And it's not like you even have to, oh, I'm not a good question asker. I don't know what questions to ask. Well, on the internet today, there are many, many trusted sources of questions you can ask your doctor. You could, from the easiest, I'm going in for my annual physical evaluation by my doctor. What question should I ask the doctor to make sure everything is covered? I'm having a cardiovascular incident. And so you can Google it, but it will take you to some really trusted sources. I mean, most academic medical centers have sections on their websites that have the specialty, the disease category, and the specialty and give you information. Also, the largest disease categories, and some even minor ones like mine, which is a rarer disease, have websites that are run by research foundations, patient communities, just patient advocacy groups. And there's so much information on that you can really put together whatever the questions to prepare for your visit with the doctor. Then the fourth part of the framework is participation. And it's by doing all of that I've just described that you are at your appointment ready to focus on the conversation and the interaction with the doctor. Because if you don't ask questions and you don't raise issues and you don't share with the doctor who you are, the doctor will make certain assumptions and will think that you understand or that you're not
Right.
worried about something or whatever. Participation is about being able to react and interact because in a way your mind is cleared of all the things you wanted to remember because you've written them all down. So now you're really, focused. You're in the present moment. Like we all know, being in the present is so important for our mental health. Being in the moment at a doctor's appointment means you're optimizing that discussion with the doctor and you're able to engage and participate more in your health. And
I
then,
love it.
thank you. Thank you. So, and then the fifth part is courage. And I needed to wrap everything around because it is scary. And I went through it and I did everything wrong. And I was in the healthcare field and I did everything wrong in my 20s, in my 30s, and part of my 40s until I had a very bad symptom that needed to be addressed. And that's when my disease was diagnosed. But Courage is really about, look, it's not easy when you're sick, and particularly if you have a chronic disease. And I was doing some research, doing a presentation to an employee benefits organization, and I wanted to learn more about, average employees, what they're facing in terms of their health care. And more than 50% of the employed population suffer from one or more chronic diseases.
Yeah.
That means more than 50% have to see doctors, whether you're pre-diabetic, whether you have dermatological problems, whether you have physical problems because you're an athlete, whatever it is, these are considered chronic conditions that you need to take care of. So we all need to figure out a way how we can, and it's not just about stealing ourselves. It's about recognizing the importance of taking care of yourself at the same time that it's really a scary proposition because nobody wants anything wrong with them. Everybody wants to go about their life. This is like an interference to living a day-to-day life. But part of my message is that healthcare needs to be integrated into your day-to-day life. Because it will get easier. Because the more you do for yourself and the more you're engaged in your care, the easier it becomes. And it's like a slow building. Each time it builds more. And this is where I am now. About 2 years ago, when I was doing my research and putting together, how should I think about it? How should I think about it for myself? And how should I think about it for other people to share this? And people around me, my world around me, my family, my friends, people I speak to, and even when I talk about this to the doctors that I see, and I still see many doctors, they're all like, yeah, that's like right on the money. That is what we need to do a better job and to lessen the stress in our lives. Because if you're not sharing it with the doctor and it's really bothering you because it's something you're feeling or something that's off about you, your gut's telling you that something's off, you have to get it out and share it so that you could do something about it so it doesn't become worse.
I love that. I love that. And it's, in addition to, I agree with you, in addition to the high percentage of folks dealing with stuff, there's also folks that are caregiving for their loved ones, right? Which makes it probably north of 75%, once you've lived a few years. Shifting gears just a tiny bit here, in the workplace as a leader, that means that half of our team or more are experiencing these things. Our health is in front of us before we could be a super productive person at work, which is what ultimately organizations want. They want healthy and also productive. I don't mean that in a mean way, but that's the thing. You're there to produce and help move things forward. I can tell you from a leader perspective, it can be awkward, right? I've had folks that work for me that I would share what they could share, and I don't want to delve into their privacy, and I also don't want to know, I don't want TMI as a leader, but my message has always been really simple, like take care of whatever you need to, and I trust you, but I bet there's more I could have done as a leader in that situation. Do you have any sort of guidance for leaders where their teams are going through or their team members are going through hard times?
So one thing that so I have been thinking about this a lot um, because employers are such an important source of resources for people
Yes.
and also as role models. A lot of people spend a lot of time at work, and if they're in a really good position, they have people to look up to as role models. No matter where
Right.
you are in the organization, it could even if you're at the top, it could be a board member, people you really look up to.
Mm,
So, as part of that, I think employers play a very big role in how to support and encourage people to be engaged in their care and be healthy. And
mm,
I guess there are two things. One is that employers invest so much money in health benefits for employees, which the medium to large size employers usually have very good comprehensive health benefits, and sometimes even more. In addition to hospitalization and medical and mental health related benefits, they sometimes have dental benefits and hearing aid benefits, and all the kinds of benefits they have. They also, and this is a pretty expensive investment to make sure you're getting the right insurance for your employee population. And then they invest in employee assistance plans. This is sort of best of class, as again, medium to large size employers, best in class will have also employee assistance programs, which may include some wellness programs, fitness, short-term mental health counseling, financial counseling, maybe some caregiver-related support system, and a bunch of other things. And then third, employers may invest in separate wellness programs that they provide to their employees, whether it's on-site or virtual, and they may buy or outsource those services. Like one employer told me that they make a meditation application, meditation app available to their employees to help relieve stress and other things, or they have their smoking cessation programs on site, or weight reduction programs on site, different kinds of programs that they have. So they make this big investment in these three big categories of programs.
Mm.
So one of the things that I think that probably employers could do more of, obviously, is communicate these resources to their employees in a really comprehensive way, perhaps have a lot of training programs or special people assigned to be able to answer questions or work with employees more on a personalized basis of how to best utilize this big investment in resources that the employer used. The second major thing I was thinking about is that really every manager, anybody who's responsible in an organization, a supervisor, a manager, the division director, however the hierarchy goes, that those people, it should be part of their job to really understand all of these health-related resources that are benefits to employees, to be able to say, so if somebody comes to you and say, I'm struggling a little bit of this, I don't want to give you any more information, it's very personal, that manager supervisor is very prepared to say, well, do you know about that we have this benefit or this benefit? Whether or not you use it or not, you should be conversant in the benefits that the employer offers. And I
Mm.
think that would really be helpful. So it means it's incumbent upon the employer to make sure all their management supervisory staff are well trained in this. Because like you said, that when people feel better physically, mentally, they're able to come with their best self to work every day. They'll either enjoy work more, they'll find it as a great creative outlet, innovative outlet, they'll be able to express themselves, they'll be able to do what they're really good at doing, or maybe explore other options and be very engaged with their colleagues in terms of producing a really good result for the employer.
No, 100%, 100%. And it those cultures are so healthy in other ways when you know that when hard times fall, and they'll happen to all of us at some point, and your company stands by you, of course, your dedication, your loyalty to them go way up. I've had that experience where I was caring for someone that was, with a acute and terminal condition, and the accommodations they made were amazing. And of course, I speak positively of them. Other people hear about that socially or otherwise. In addition to the goodwill, it's like, oh, this is a really great company. This is how they show up. If I'm looking at a job change situation, I'm going to look for a company like that. And it's so important, and it's relatively simple. I mean, these are, I don't want to, I'm not trying to belittle your work. It's incredibly important work, but these tools and these approaches are straightforward. Like it's something we can all do, I guess is what I'm trying to say is, have you encountered anyone, challenged to be able to put this together as you've done your work?
Well, I think that the reason I feel like there's a message to get out there is that even though provider organizations, whether they be hospitals or physician practices, or certainly you can't rely on an urgent center to want to help people understand that there's a better way. There's a better way to, engage in their healthcare. And, there's a lot of pressure on doctors and there's a lot of pressure on hospitals, and there is a lot of focus on the patient experience.
Mm,
But if there isn't a section of that focus on how do we get people to understand that they have certain skills and they can optimize those skills to be able to engage in the healthcare more, how do you get people to engage? Not just measuring, oh, this person is better at it than others. For some people, yeah, it comes more naturally. They're good communicators, but there's a certain finesse about that. I keep going back to that 15 to 20-minute appointment. And I have some friends who are great communicators, and they have told me, yeah, I never write anything down, but once I leave the doctor's office, I forget everything the doctor told me. So it's really about, it's like, it's, I akin it to, if you're going to buy, let's say, a house or a car, a very big purchase, you're going to spend time researching it.
yes.
Some people make spreadsheets. You're going to write, you're going to go look at reviews. You're going to, maybe want to test drive something out or go look at it or find out or walk through a neighborhood or, go to 10 dealerships to get the best buy. You're going to put in that much effort to buy a house or a car. Don't you want to put that same kind of care and effort into your visit with the doctor and then everything that follows that visit? So the visit becomes, and the preparation for that visit becomes really that foundation that you're laying for what do I need to do next?
Mm,
What else do I need to learn about? What else do I need to research? So, yeah, it may seem like simple concepts, but it's not something that anybody teaches in school
right.
or in college in a health class. I certainly didn't learn it, and I have a master's in healthcare administration, and
Right.
nobody talked about how how this communication between a patient who's not clinical and a doctor who is clinical, how the two come together and meet. There parenting experts, human development experts that talk about developing a relationship with your child. There are books now about having a better relationship as an adult child with your parent and all this stuff. So I just feel like this void about helping people cope with seeing doctors and being engaged in their care.
Yeah, 100%. No, I totally agree. I'm so glad you're out there doing this work. For folks listening that are in corporations in leadership and would like to bring you in, what's the best way to engage with you and talk about making that happen?
Well, I do have a website, thethinkingpatient.com, and I actively post on LinkedIn on a weekly basis, and I do research and I post content, and so it keeps sort of like the thoughts and the strategies rolling to get input from the LinkedIn community. So I could be contacted on LinkedIn, probably the most direct in my emails on LinkedIn as well.
Great. We'll put that in the show notes. So, folks, if you're exercising or driving, don't hurt yourselves. That'll be there for you afterwards. You can find it. Dana, so important. And I love that this is something anyone can do and we can immediately take action. And you're only going to see positive results from it and being engaged in your healthcare. I love the comparison of buying a car, buying a house, and we can belittle our own health and like, oh, it's not that big a deal. I'm like, it's the biggest deal. It's way bigger than a house or a car. And what a great example of walking through that. Before we close out, I ask this of all my guests, Anna, what's something that's on your mind that you're grateful or thankful for today?
Well, I would say modern medicine that corrected a genetic abnormality and that allowed me then really to continue on and be on this side of life and to be able to share what I've learned and share that with others and meet others in similar situations. So I'm very grateful to be here, and I'm really happy I have the opportunity to have met you and to have this discussion. So thank you, Chris.
Oh yeah, you're very welcome. My pleasure. And friends listening, please do like and subscribe and do all those things for the algorithm. But more importantly, share this with a friend. I'm based on the statistics we've shared today, that's likely you've got a friend going through something. And nothing like sharing this podcast. It's a very loving act, and you can actually positively impact their health from them being more prepared and knowing how to talk to their care team. It's only a positive thing. So season of giving, it's a great time to give. So feel free to share this with them. And again, thank you for leading the way. We'll see you next time.
Thank you for listening to Leading the Way podcast. Be sure to like and subscribe so you won't miss other great episodes like this one. And if you're ready for more in your workplace, be sure to go to aintent.com. You'll find lots of free tools, assessments, and ways to engage directly with us to get your own epic results. We'll see you there.